My name's Andy Williams. I'm one of the founding consultants here. I'm a knee surgeon. My decision to go into medicine was a sudden moment, actually. Nobody in my family had ever been to university, let alone done medicine. And if it wasn't for Mrs. Hayward, my biology teacher at grammar school, I'd be a builder. A lot of us have been abroad for a year to further our education and training. And in countries such as Australia, where most of us went, there were bespoke units dealing with musculoskeletal problems. It just seemed the obvious thing to repeat that back here. They're high quality, high performance units, and that's what we wanted to do. The naming of the clinic was interesting. We spent hours thinking about names, and in fact it was Jonathan Lavelle walked in one morning and said Fortius. We knew immediately that would be the name of the clinic. It was perfect. It's part of the Olympic motto, Fortius, Altius, Citius, and stronger seems like a good name to have. I think the first thing to say is it's a position of considerable privilege but also responsibility. And I find myself now worrying not just about my patient but all the patients at the clinic. And being on the board means I really care about the patient experience regardless of which clinician is looking after them. So the benefit for the patients is that there's an element of secondary supervision from clinicians who are on the board. One of the joys of our success, of course, is the challenge of keeping standards up. At the beginning it was simple. Clinicians only joined Fortius if they passed the test, and the test was that they would treat myself or my family. But of course we've got to have due diligence followed by governance, and governance means audit, it means a close inspection of people's practices, and we take that very, very seriously. The growth has been massive and beyond our wildest dreams, really. Our brand is building and building, so that's a really exciting thing. I mean, we've gone from 12 to 80 clinician consultants. And the other aspect is our geographic growth. We've moved from one clinic in Marylebone to a second clinic in the City of London, and then a surgical centre also in Marylebone. I work at all of the 3 Fortius bases, and they're all fantastic places to work. The environment is tremendous. It's uplifting to walk into King William Street or the surgical centre, for example. The patients absolutely love it, and that reflects well on us. It makes work easy. I'm very excited about the Joint Replacement Centre. It's a fantastic opportunity for us to really trailblaze. We also have invested a lot of money into a robot to improve surgery. The performance and longevity of a prosthesis is highly dependent on the position it's placed within the bones concerned. And with the use of the robot, my x-rays now are perfect every time. It's extraordinary. Also because of the robot, the trauma to the patient's knee in my case, or hip in others, is less. We don't have to pull hard on tissues, get access to allow visualization. Patients as a result have less pain, less swelling, and recover much more quickly. We strongly believe in the importance of a holistic approach to treatment. It isn't just about a knee or a hip or a shoulder. Surgery is obviously a great part of what we do, but it's not the whole part.